treatment to do. They have to be consented like every other Botox patient. Julia is our model for today and she is consented. All you need to do is dilute 2.5 mils of normal saline. So you just draw up the normal saline to 2.5 mils. You pop it into the little bottle, and you can get these through head office, the bottles. So you put your 2.5 mils in the bottle. Then you're going to draw up 8 units worth of Botox. So that's exactly 8 units of Botox. You're going to put the Botox in the bottle. Put the little spray bottle on and you're just going to swirl it like that. And then what you do is you give some tissues to the patient. The patient cannot have a runny nose. If the patient has a runny nose already, it's not going to work. It's just going to drip straight out. So they need to be completely dry before they do it. We get the patient to spray it up their nostrils. So they do 2 sprays in each nostril, just tilting forward, and you can have a breath in between. And what you want to do is you want to snort it up. So you want to like that to really get it up into your nostrils. Okay. This treatment will take effect in around 2 to 3 weeks. At week 4, we should get you to come back in and have another treatment, and then it should last you around the 4 to 5 month mark. Usually we try and get you to do it just before spring hits, so those pollens and things like that, it'll get you through that, but it's a little bit after spring now, but that's normally what we'd recommend you do around August or July, August. It's best to come in then, so then it will get you through those hay fever months. It's best for people with seasonal hay fever, so due to the pollens and things like that in the air. If you've just got hay fever all the time and it's not from seasonal issues, then it still may work, and some of my clients do get good results and then some don't get any results. So you have to be really open with your client explaining that to them, because you don't want them to be disappointed. Some people, it reduces it by about 20%, and some people will get a 60% reduction. It just depends on, each patient's really different. But most people that suffer hay fever are happy with any sort of reduction. Okay, so 2 up each nostril, and then you can have a breath and just sucking it back until it's all finished. So it'll take a bit of time. So
1,
just
2,
2, and then 1, 2 in the other nostril.
Okay.
And it will take a little bit to spray out. So just do a couple of sprays.
Even velvet.
There you go. It's coming down. Good. That's it. Now we have to wait with the patient until it's completely empty, and then we put it into the bin. You never let them go home with it. Keep going until it's finished.
Oh, okay.
Yeah. And that's basically how it's done. So you won't have to watch it the whole way. But it will take about 5 to 10 minutes for her to get through the whole vial, the whole bottle, and then we just discard it ourselves. So don't let the patient take that home. We don't know what they're going to do with it, whether they ingest it or anything like that. It's only a very small amount of Botox, so 8 units. So some people say, oh, what happens with breathing and things like that? It won't affect it because it's a low dose. We never go above 10 units. So I start them off on 8 units. If they are all fine with the 8 units, then the maximum I would go is 10. I never go beyond 10 units. I always use Botox. I don't use Dysport because all the studies that are sort of being done on it is all related to Botox. So I just stick to Botox. I charge $150 per treatment. So if they have it now, in a month they do another $150, then that should get them through the next sort of 4 to 5 months. All right.